So, good evening, everybody. Welcome to today's webinar by KHA Homeopathy Study Group and Homeopathy 360. I welcome you all to this webinar series, and I hope you're glad to you are excited to learn today once again. So, I would like to request our organizer, the lady behind this webinar series, Dr. Kavitha ma'am, to please take over. And as you all know, that she has been with us since long, and I have she was the speaker for the very first day and a homeopathic practitioner from India, and she completed her BHMS from University of Health Sciences, Andhra Pradesh, India, and has been into practice since 1995. She moved to USA in 1998 and served several homeopathic organizations in this past years, pro bono as board member, administrator, advisor, and president and CEO. And she has also conducted over 50 monthly professional webinars providing HNA EU, integrating world-renowned homeopaths from around the globe. She mentors students and conducts lectures on homeopathy and prophylaxis internationally. And in US, she is a certified classical homeopath, CCH, and outreach coordinator of CHC PR committee, a registered member of NASH, a certified HP supervisor, and president and CEO of Kavitha Holistic Approach, founder and director of KHA Homeopathy Study Group, LMHI member, and lifetime member of National Center for Homeopathy. She's also a board certified alternative medical practitioner from American Alternative Medical Association. Also a member of Camel Foundation serving poor people in greater needs in India. So here I welcome her and I request her to please take over the session from here. Oh, great. We have Regina ma'am also joined with us. So before we begin, ma'am, can we start with ma'am's Gayatri mantra?
Please.
Are you ready, Regina ma'am?
Oh, yes, please.
Please proceed. Please start the session.
Thank you.
I think your voice is there. Some issue is there with the voice, Regina ma'am. I think some connectivity issue. Are you able to listen, Kavitha ma'am, to Regina ma'am?
No voice.
Yeah. So, Regina ma'am, please refresh your page once. I think she'll be joining us back. Ma'am, by the time you can start and then we'll have the inauguration by Regina ma'am.
Yes. Om Shanti. This is from Regina, Professor Regina. Many blessings, Dr. Yashika, for beautiful introduction, and I give all the credit to KHA Homeopathy Study Group team. Hello, everyone. Welcome to KHA webinar series in collaboration with Homeopathy 360. I want to sincerely thank Manish Jain, the Managing Director, and Dr. Yashika for giving this great opportunity to KHA to share holistic approaches of healing through energy medicine. Just like name sounds, Homeopathy 360, Dr. Yashika promotes Homeopathy 360 days. She's very sweet, dedicated, and inspiring to all young homeopaths. She's doing amazing job, working very hard on this webinar series. I congratulate Manish Jain, Dr. Yashika, and entire Homeopathy 360 team for the great accomplishments. It's a wonderful platform connecting homeopaths around the globe with the latest updates, events, job opportunities, materials, and many more with the best online services. Please visit the website homeopathy360.com. KHA Homeopathy Study Group is the first homeopathy pro bono study group from United States that has come up with this new concept of uniting world-renowned practitioners throughout the globe. KHA's mission and vision is very unique. to inspire young homeopaths, mentoring, providing excellence in educational purpose of holistic approach by continuing professional educational webinars. To practice the following principles of classical homeopathy. Ka celebrates stage 4 cancer survivors through inspirational book talks. Our honorable speaker for today is young dynamic homeopath Dr. Yashika Arora. She is MD Scholar in Homeopathy. She is managing head and content developer of Homeopathy 360. She is very enthusiastic and a great resource of our Car Study group. Always prompt, and we love her beautiful flyers and website updates. Dr. Yashika, an alumni of NHMC Delhi, is currently pursuing MD Homeopathy from DKMM HMC Aurangabad, achiever of STSH 2015-16 scholarship program organized by CCRH Delhi. Title Efficacy of Homeopathic Medicines in Treatment of Alopecia areata. A speaker at various platforms and took various webinars recently with Aurangabad and Arthur Group, Homeopathic Development Association, KHA, AHMA, Kavitha Holistic Approach, Bhargava Phytolab, Homeopathy 360, Homeopathy Junction, Asha Homeopathy Academy, and many more. She completed Homeopathic Icon Award by Delhi Homeopathic Federation in April 2019. Chikitsa Seva Ratna Award awarded by Bharatiya Homeopathic Panel in 2019. She is a young dynamic homeopath organizing webinars, regular CMAs and seminars in Delhi and all over India with various homeopathic associations. She is winner of several like essay competition in HMAI on relevance of organ and homeopathy practice. Speaker on one side, it says there is so much to say about Dr. Yashika Arora. She has written many articles for the magazines and journals for all the famous homeopathic organizations. She got appreciation award by Board of Homeopathic System of Medicine Delhi in 2018. She won the Homeopathy Icon Award by Delhi Homeopathic Federation in 2019 and third prize in CCRI film video making competition. There is so much to say. I will leave some to Dr. Sweta. Please speak few words about Dr. Yashika.
Yes, ma'am. I want to welcome our youngest speaker of this series. She is so dedicated. She is dynamic personality who is an inspiration to the budding homeopaths. But her positivity inspires us also. So this is she is doing a lot of work and excellent work and promoting homeopathy not only nationally but internationally also. So a very congratulations for your achievement, Dr. Yashika, and we look forward for a great presentation today. All the best, dear.
And Professor Regina is also here. Please.
So, ma'am, please continue your Gayatri also because there was some connectivity issue.
Om Burvat Swaha Tat Vari Bargo Ahi. Oh, yeah. Many blessings, such awarded homeopath, Dr. Yashika, ma'am. We are looking forward to your presentation. Thank you for this great opportunity of watching you again. Blessings to you.
Thank you so much, ma'am, for your kind words, and I am glad and overwhelmed. I would say that has so many accomplishments that I would say that not achieved anything yet, and there's to do.
Your voice is breaking, Dr. Yashika.
Wait. Just give me a minute. I'll just join back again. By the time, can you please talk once 1 minute? I'll just join back again.
Sure. So today's topic is on Tinea. So Dr. Yashika will give us more insights and with her experience and several cases. It's a beautiful, she made a beautiful presentation. We have a lot to learn in this webinar.
It's such a blast to being able to listen to Dr. Yashika. She's so young, so many awards, so many prizes, so many honorific titles she has been given to her. And she encourages us to be a better person. It's a bless. Welcome back, Dr. Yashika.
Thank you, ma'am. My voice is clear now.
Yes.
Am I audible now? No. Okay, thank you so much. I think some internet issue was there. So I'm just uploading my presentation. By the time, I want to thank Dr. Kavitha Kukunur, ma'am, for giving me again this opportunity. Ka Homeopathy Study Group, Kavitha Holistic Approach, Professor Regina, ma'am, Shweta, ma'am, and the whole team of Ka Homeopathy Study Group for
We lost her voice, right?
Yes.
Hello?
There is some network issues, I guess, from her side.
Because when we refresh, it takes time to load everything back.
Hello, Dr. Yashika.
Now I'm audible, ma'am.
Yes. And please turn on your video.
Okay, thank you so much. Yeah, my video is all right. Ma'am, can you please check? I think Dr. Kavitha, ma'am, you must be having my presentation in your slides.
Yes, I will. You want me to open it?
Just if you can, I'm uploading it, but yes, it will take time. So if you have already, can you please start? Under slides, no, on the same platform, slides option. Mein.
Okay. Oh, sure. I'm trying to open my email. Okay, no problem. Here only, right? Yes.
No. You just open the slides option. Right side, mein lower corner, mein slides option is there.
Yes.
Just
So
click on it. There must be a presentation on.
Yes, I'm starting.
Yeah. Thank you so much. Thank you so much, ma'am. Thank you.
All right.
I hope. Yes. Thank you so much, ma'am. So, I think now the internet issue is gone, Dr. Vismay. And thank you so much, Ka Homeopathy Study Group, as well as Homeopathy 360 once again. I want to thank Mr. Manish Jain also at the home of Ka Homeopathy Study Group for giving me this opportunity to present on this platform once again. That too on this webinar series, that is an international webinar series organized on the holistic approach of homeopathy. So here I am. I've taken this topic, very precise topic I've taken to today, which is a very daily, which physicians come across daily, that is tinea. So I think everybody is aware about tinea, what is actually tinea, the types of tinea. But before we begin, we'll be studying this session. We'll be studying different types of tinea also, and then we'll be discussing the case approach as well as how to reach to the remedy and how to repertorize the case. So but before I start, I want to thank everybody for joining us today and the whole audience for joining us and listening patiently. And also, I want to thank our Homeopathy Study Group, Dr. Kavitha Kukunur, ma'am. She needs no introduction. She's such a down-to-earth personality. And all these speakers, all our team members, all our colleagues with the at the Ka Study Group. Thank you so much, everybody, for joining us as well as promoting this event. And now I think it's a time that I should start the session of today. And as you all know that today's topic is tinea. Tinea comes under the skin infections we come across daily. I think a homeopath is a homeopathic practitioner comes across skin infections, various types of skin infections on a daily basis. Still now, I would say, and in the COVID pandemic times too. In the COVID pandemic times too, the skin infection cases are coming up. And recently, yesterday only, I heard a study that somebody posted in some of the groups. I don't know how much truth in that study is there. I went to the link and then studied that the COVID pandemic, whoever are suffering from the people who are suffering from COVID-19 pandemic, they're also having so many skin infections which are coming up after the pandemic, that post COVID there are some complications which are occurring, and which can be easily treatable by homeopathy. So I think there is a great scope wherein we are already putting up many efforts in COVID-19 pandemic. Again, if the skin affections which research is saying, so I think that there we can prove more beneficial. So we are to discuss various types of tinea, as well as a case of tinea, how to crack the case and how it improved. I'll be discussing and sharing my case of tinea through a holistic approach. So how I repertorized the case and holistically managed tinea. So as you all know, there are fungal infections of skin, many fungal infections of skin which we face and which we come across. There are many, for example, Tinea corporis, which we call as ringworm, and which occurs as Tinea fascia or Tinea gladiatorum. Also, we come across Tinea capitis, that is the ringworm of scalp. Then Tinea cruris, which is a jock itch, which come across the groin region, and then Tinea pedis, that occurs in athletes commonly. That is also known as an athlete's foot. Tinea anguum, which is again occurring in nails. So onychomycosis may be present, and Tinea manum, which is also commonly present with 1 hand and 2 feet involvement, and many other types of tinea like tinea barbae, which occur over the beard, and the tinea incognito, which occurs as the dermophyte. Like whenever people are taking steroids, they come as across the dermatophyte infection across the region where the lesion was there. I'll be showing the pictures so that you can correlate it easily. And also there are many skin infections like candida infection, which is due to yeast. So that may also cause the infections in the nails. The nails may become dystrophied. So there may be the shape of the nails may be disturbed. And the pityriasis versicolor, which formerly occurs as tinea versicolor. And there are various uncommon fungal skin infections which involve one or the other organs, which we come across daily in our practice. So tinea is a very common skin fungal infection which is being caused by keratinophilic fungi, which may affects the skin, the body, man of the body, the skin over the body, as well as the nails. That can affect or the hairs, whether the hairs of the scalp or the hairs of the beard. So it can affect or in other regions. I hope I'm audible and visible to all of you, and you are enjoying the session. If you get bored, then do comment in the chat box. We'll discuss the case first, and then we'll discuss the other management or the other parts. So kindly be attentive and interact. So as you all know that this is a picture of different types of tinea, which may present as a patch of various colors. That is a scaly. You can see they have scales. This is surrounded circular patch, the reddish papule over the face. You can see the small vesicle form. It can occur on the back. Thank you so much. So thank you so much for the comments, Dr. Seema, Dr. Shala. And then you can see it progresses, how it progresses. See the radish papule, the small vesicle is inside, and there are little pustules, and then that it is progressing over the periphery. And then see the shape of this shape of the rash which occurs in the lesion, the shape of the lesion which occurs in tinea. It is a ring-like shape which is occurring circular. You can see on the back also, you can see there the periphery region, and all over it is covering. It is almost of a ring-shaped color, ring-like shape. So these are the pictures which we were discussing just before. I just shut off, put my video in short. So here you can see the tinea pedis, how it occurs in between the toes. In between the toes, you can see the foot, how it is showing the redness, and in between the fingers, the redness is being visible. You can see tinea corporis, which is a which affects the arms, the legs, or the trunk. Wherever you see, like wherever in different parts of the body, you see over the abdomen or over the back or over the legs. If you can see, this is the form of tinea corporis, which occur commonly and affects the skin, the body of this body. And then you can see the groin region, the tinea cruris, the third number picture. So the third number is this tinea cruris, wherein which is also known as a jock itch, and this affects the groin area. Usually, when the ringworm, this tinea occurs over the groin area, it is termed as tinea cruris. So next is tinea barbae, which is occurring over the facial hair region, beard region where the beard occurs. So this is known as tinea barbae. And then the fifth one is tinea anguum. That is, you can see below the nails, the yellowish thing is happening. This is visible. So that is ringworm of fingernails or toenails, whether it's occurring in the fingers of the hands, or nails of the hands, or the nails of the toes. So then next is the tinea manum, that is the ringworm of hands and palms, like the hands are affected or the palm is affected with this type of rash. This is known as tinea manum. And then tinea capitis is when it is occurring over the scalp region. See the bald child picture, that is having circular type of lesions, rashes, and then lesions are there, and this is clearly showing that it is the ringworm of scalp, that is tinea capitis. Then we have tinea fascia, that is the face fungus. Whenever the tinea is occurring over any part of the face except the beard region, I would say. So see the here it in the picture, and there it is being shown that, and it is near the nose. So this is what is occurring is the face fungus, and if it affects the any part of the face, it can affect. So these are different types of tinea cruris. So in the summary, if you want to remember it in short, so you can remember it with this picture, like the whole body affected, tinea corporis, tinea cruris when the genitals are affected, the genital area. Anguam means the under the nails region, fingernails region, and the fascia means face. Pedis means foot. Easily you can remember. Barbe means the barber, as you remember the beard region, you can say. So it is very easily can be remembered. And this is to note here that usually when you talk about tinea cruris, it may be sexually transmitted, or it may be due to some of the sexual affection that it is happening sexually transmitted. It may be sexually transmitted. And then athlete's foot I already told. Beard usually in men. Tinea barba it occurs in men. So again, this picture is showing you the parts wherever these affections are coming. This is just a summary, and the point I picked, have put this picture is because it's showing how they occur. The character of the lesion is this picture showing how, like tinea fascia usually occurs, includes the bumps. They includes the blisters. They may include the blister form for blisters over the face. They may be occurring, or they may be occurring on this as scabs, as face scab formation. Just a scab ban jata hai, वैसे it may be seen as a spot. And usually the edges of those tinea fascia के जो the lesions होंगे, in those lesions the edges would be raised. When you talk about tinea capitis, so they would be round, itchy, scaly spots, which may be very much similar. Guys, you must have studied mesarium, so I think you can relate to that that lesion also. So that they may be dry scales, and they may be similar to the dandruff, like is seen in Miserium and Vinca minor. And usually they most commonly occur over the bald spots where there is loss of hair, and it may also be pus filled. So do remember that Kirion, which is known as Kirion, that Tinea capitis may present as a pus filled lump also, pus filled lump over the bald area. And when it goes to the severe form, it is also termed as the Tinea favus. Like it is Tinea capitis is also given a name of favus. So when the pus filled lump goes into the extreme case. Then the tinea barbae, how it has occurred, it is just a crust which occurs, and then the swelling is there in the circular formation. And then the tinea corporis, very commonly seen over any part of the body when you go, wherever in the body folds, in the back region, or over the this part, axilla region, or trunk, the abdomen part. So there are patches which are prominent, mostly in the body folds. Here also you can see that there may be some eruptions which may occur as pus filled. So which is an extreme form of tinea. So you must remember that it may also occur as a pus filled lesion. Then we have tinea manum, which we were talking about in the hands and the palms region, or in the over the hands, above part or the palm region. So there may be rashes which may be seen. There may be also blister formed. So skin may also be discolored whenever the tinea is occurring over the palm region. Then tinea unguum, as you all know, very commonly seen onychomyosis. The yellowish streaks may be present inside or under the fingernails. Then the nails may be crumbled up, and white patches may be there, or nails may even be damaged. So in such cases, it is termed as tinea unguum, and the very good remedy for tinea unguum, which I have seen in my practice, is andim crude. It works great. And then we have tinea cruris, which is very commonly, very commonly found. Like tinea corporis and tinea cruris are the two most common tinea we come across during our practice. Like the itchy reddish brown rashes occur over the groin region, and the spots may also reach to the buttocks region. They may also reach to the buttocks. And then we have tinea pedis, which occurs commonly in athletes, and there is irritable skin which occurs, peeling off skin. Skin would peel off, blister formation would be there, and the entire sole or the heel, which is the heel part of the foot, which may become dry. So the inflammation won't be occurring. Tinea pedis may inflammation won't be occurring, but they may become dry, and the skin may be peeling off, irritable. And then when you talk about tinea incognito, see, I was telling you, any ringworm affected area, wherever the ringworm had occurred, it may develop like this over the sides region. They may become bruised. The blood vessels may be seen visible, and they may be visible, and the rashes may be raised and scaly. So this is known as tinea incognito. When you talk about the cause of dermatophyte infection, usually tinea rubrum is most commonly seen in tinea corporis. Other which may be seen as tinea mentagrophytes, or E. flocosum, or in tinea barbae, you can see tinea varicosum, which is being seen. This is just the differentiation, and we already discussed the diagnosis, the clinical manifestation, how they are visible, where they are visible. That it all depends on the location, that we term tinea as the type, like tinea barbae, or wherever the location is, the rash lesion is there, we term it as accordingly. So you need to take care. Differential diagnosis, we no need to discuss. We already discussed this thing. So types of when you talk about this types of tinea, this is the clearly different things, like peeling and cracking of scaling of feet is there in Tinea pedis. Tinea corporis, there are itchy red ring eruptions, which showed on any part of the body. When there is candida infection, usually in females, when you talk about candida infection, candidiasis, there may be itching and swelling around the vagina, and there may be burning sensation during sexual intercourse or during urination. And there is unusual vaginal discharge, which is of dark yellowish color, or it may be yellowish green in color. So it depends on the affection, and redness may be present, soreness may be present. Toenails we already discussed. Tinea versicolor, we already discussed that it is the infection of the skin. Affected area is lighter or darker, and dry, scaly, itchy skin would be present. And when you talk about the nails, so nails clearly shows that this is like if there is mild infection only, the above part is affected, and then that is very light yellow in shade. When you talk about yeast, mold is affecting. So this is the mold fungal infection, when the molds are affecting. When the yeast infects, they may be dark yellowish, and when the tinea unguem occur, that is purely yellowish. So you can differentiate tinea with mold infection or yeast infection in nails. So it is totally yellow in color, and that would be very dirty looking, and it would be almost damaged. The nail would be almost damaged when you talk about tinea unguem. So this is already discussed. The prevalence, when you talk about prevalence of tinea, it is very much common in developing like countries like India. And usually we adults are most commonly affected because of the lifestyle we are living, and the using other person's clothes or towels or anything else, or getting affected easily by whatever we are doing, whatever lifestyle we are following. So we adults get more commonly affected, and usually most males are more commonly affected than females when you talk about tinea. The causes are usually one we discussed already, that due to dermatophyte fungi, the tinea may occur. And when you don't wash your hands regularly, which I think nobody is doing nowadays because of COVID. So everybody needs to wash hands, and we are into this is a very good habit that we are developing due to this pandemic, that we should regularly wash our hands. And if we come in close contact with the person who was already infected with tinea, or he or she is already having ringworm, so then we can also suffer from ringworm. Or we are using their towels, we are using their clothes, or we are coming in contact anyhow with the affected person, so that can affect us also. And when you keep your skin very wet for long, like the body, people who are not who wash their hands, and then they are not they do not use towel or something, like keep their skin damp for extended time, then also it can lead to ringworm infection. So do remember that don't go for crowded damp places, because there more chances of tinea infection is there. Then we have unhygienic conditions also. Usually when the patients come to you of tinea, so maximum patients, if you talk about, they are from unhygienic area. So they may belong to slum area, or they may belong to crowded places wherein people are will live close to each other, and they don't follow hygiene, no, not bathing or something. Then they may be unhygienic conditions. So the tinea is most common. If the person is sweating, we already discussed, if the body skin is damp for long. So the people who perspire very much, who have increased sweat, they may also develop tinea. Who are obese, they may develop tinea in their folded region, skin folds. And who are also having systemic diseases like HIV or diabetes, because of their immunity which is low, and the lifestyle disorder they are facing. So they can also suffer from tinea. We can also suffer from tinea. We wearing damp clothes. If you wear damp clothes, like you got wet in rain and then you guys are wearing damp clothes, so I think you can all the person wearing damp clothes for long, usually when the rainy season is there, that can also develop this infection, and fungal infection may occur as tinea, or sharing personal clothes with infected person. And the diagnostic test we go for during this when you come across a patient of tinea, though it is very much visible from the examination point of view only. On clinical examination only one can judge whether it's tinea or not. So tinea corporis, we go for visual inspection. That is the main thing. And then we can also go for potassium hydroxide preparation culture. So usually this culture may be taken, and the culture of this where they'll take the culture from the lesion, and then they go for this test, and then they can judge that it is tinea corporis or not. Tinea capitis also again for this potassium hydroxide preparation culture may be done. And for onychomycosis, again, there may be also this shift stain is also very much useful. Periodic acid shift stain is also very much useful as the diagnostic standard for onychomycosis. But maximum sensitivity and specificity is of visual inspection. So do remember, when you are perfect at identifying tinea, so then you can easily identify it. So we are going to discuss the case of tinea corporis today, and this you can easily see that it occurs over the body, and we already discussed the circular rash which may appear on all surfaces and spreads through direct contact. Like I am having tinea corporis and I get involved or I get in touch with another person, that he or she may also develop that tinea corporis because of that infection from my end. So you must remember that it is just a superficial dermatophyte infection which may be transmitted directly to other person, and is usually characterized by inflammatory or non-inflammatory lesions over the hairless skin. So tinea capitis is over the hairs, and when you talk about tinea corporis, that those areas which do not have hairs, which are the hairless regions. So with here only it may occur. And tinea corporis is also annular lesions which active periphery, like the periphery would be dark. You can see that there may be dark the circular shape lesion would be there, and over the periphery region, over the corner of the circle, there may be much population, like the dark pinkish would be seen. There may be vesicles formation and the scales would be seen. So this is again the type of the presentation which is being seen in tinea corporis. Like tinea corporis gladiatorum, which we talk about, is usually when the wrestlers come in contact, skin contact, that may occur over the head region or the neck or the arms. So tinea incognito, we already discussed that it occurs over where the blood vessels are prominent enough, and these are different types. And then the signs and symptoms which occur in tinea corporis are large erythematous scaly plaque, which will be seen over the any part of the body, and macules may also be present. Annular plaque formation may also be there. So different presentations are there. It depends on the case which you are coming across. So this will be discussing in the end rubrics given for tinea and the different medicines. So now we come to the case of tinea corporis, which came to me around a year back. So when I was taking the case, a lady of 42 years visited the OPD, and she complained that she has dry eruptions over the lumbar region, over the back, since past 6 months. And she was also complaining of itching and burning over the eruptions since those 6 months. And the lesion was the eruption was she very much the eruption didn't occur very suddenly. It was a gradual formation, like it was very small for the first, and then it has started growing, and now it's very much irritating and creating problems for her. There is extreme burning, there is extreme itching, and the lesion is progressing more over the lumbar region. I'll show where the lesion was also there. And she said there is no relief by anything except for allopathic medicine. I take allopathic medicine, I take cetirizine, I take this medicine, I take that medicine, and then I am better for the time being, and then it occurs again. While going through the case and taking the complete case, I'll show you the lesion, how it was for the very first visit, and then how it improved or how it went bad. So the physical generals included the appetite. She was very hungry. She used to feel hungry after every hour. Then she had craving for fried food, for sweets also, and she was having सबसे ज़्यादा craving was for sweets. Then it was for fried food, especially fish was very much. She was very fond of fish. Then she had aversion to sweet potatoes, and then the perspiration was very much profuse. She was a healthy lady, and the perspiration, when you talk about, was profuse over the forehead region and the soles region. The sleep was normal, and she was a hot person. So she said that she cannot bear summer season, and she's very much frustrated, and the things will go wrong when there is summer season, or she doesn't feel good. When I asked her about any habit of hers or what she likes to do, so she said she likes to watch movies and listen songs, and usually the love stories or the melodious songs she is very fond of. Then when I inquired further about her mental journals, I asked her what all are you getting, what all are you mentally, how are you, like how is everything at your end, and what is your thought process, how do you behave. I inquired her about from her. So she said ki very little trifles, on मतलब छोटी छोटी बातों पे she get very much anxious. So she said ki I get very anxious easily, and then I also shout at others when I'm angry, and I easily get angry when someone doesn't listen to me. So she said ki easily, clearly, that whenever someone doesn't listen to her, she easily shout on that person, and on short trifles she get anxiety. On local examination, that there was a macular eruption which was seen on the lower back, that is approximately on the lumbar region. Wait, I'll show you the lesion. I think I put in the wrong slide. So when I saw this lesion, this was the first visit when I saw her. This was this eruption when I saw. So this see the back region, it was occurring, and this was the first visit lesion. So when I asked her and inquired, so I processed the case, and I took the rubric. So I want to ask everybody who all are listening. So now it's your test, guys. What all symptoms you took for the totality? I'll show you the symptoms. So what all symptoms and what all suggestions you want to give, that what would have been the remedy of this case? Eruption with burning, dryness, okay, sepia. Okay, Dr. Utpal. Any other person? And the why sepia? I would also love to know. Eruption, burning, dryness, and how she used to feel hungry at every hour, craving for fishes, aversion to sweet potatoes, profuse perspiration, hot thermals. Okay, again, Dr. Poonam, sepia. Thank you. Why sepia? Any other suggestions? She used to get angry when somebody doesn't listen to her, and she was anxious on little trifles. She was not having any indifference like CPR. So I think how can somebody suggest how can what all symptoms go for CPR? Sulfur, okay, great. Dr. Tong, Dr. Kavitha ma'am. Lycopodium, great. Sulfur, Dr. Shoaib. Any other suggestions? Why sulfur? Why lycopodium? The affection, I think it was not on the right side. It was on the left side. Yeah, it was on the left side. Okay. Any other suggestions? Colocin, natramure, great. Dr. Ati, thank you. Any other suggestions? So thank you. I hope I think if people were attentive enough. So I just wanted an interaction. So I diagnosed the case as Tinea corporis, and the diagnosis was this phase, which came to me when she came to me. So it was a dynamic chronic disease with very fully developed symptoms in past 6 months, and the susceptibility of the patient was high, and the pathology was easily reversible. So that was not a very difficult case to crack. So repertory I used was Homepath, Zomeo, classic software. So the repertorial totality I found was mind, anger, tendency to easily get angry. Yeah, natramine, sulfur, thank you. Petroleum, great. Okay, so mind, anxiety, I usually repertorize the case and then solve the case. Mind usually, anxiety trifles about. And then in the generalities, I took as sweet desires, desire for fish again. Then skin eruptions, itching, the itching was present, especially at the night. And then the eruption was dry, and the eruptions were painful and burning also. Great. Yes, CPI is very good remedy. Yes, sir. So when I repertorized the case, it was a very, very easy repertorization and a very commonly found remedies, which we already discussed here. So yes, sulfur also came, lycopodium also came, arsenic also came. We were getting these suggestions, and all these like sulfur scored 6 rubrics and 14 marks. Arsenic scored 14, and then five rubrics it covered. Mercurius 12 was the mark, and 5 rubrics it covered. So I noticed that there was itching at night, which was only seen in sulfur, merc, and phosphorus and silesia. And then the symptom, the desire for sweets was high in arsenic and sulfur again, and there was tendency to anger in sulfur, and arsenic and merc is seen high. So natramure, usually when I prescribe for this itching lesions, yes, they are very much. Natramure, I've also got very good results when their regions are dry again. So yes, one can go for natramure also in such cases. But I rely, if you talk to me, and I rely on natramure for this. So I try to find some of the I go into the patient's life for that. So I try to investigate more on the nature of the person and how the ringworm started. So here in this case, I didn't get any mental thing which could lead to, which could cause this ringworm. There was no pathology behind. There was no mental pathology behind this case. So that's why this case was considered normally a repertorization. Normal repertorization was given. So eruption during first prescription was this. And then first prescription was only sulfur 200. That is a very commonly used remedy. And you can say the Master Hahnemann has always said that you should not have favorite remedies. But yes, I've got very good results in many cases of tinea or skin infections. I've got many good results in scabies and other infections also with sulfur and different potencies as per the case. So here in this case, only sulfur 200 1 dose start was given along with placebo for 15 days. When you talk about remedy justification, why sulfur was given, so that the lesions were burning and painful. We already said that itching, there was night aggravation, itching was there, and dry eruptions was there, desire for fishes was there, and the thermal reaction of the patient was extremely hot. So sulfur is a very hot remedy. CPA also is a very hot remedy. But then the when you talk about those mentals covering, the totality was not there, which I was searching, which I when I repertorized the case, which I got. So then I also told the patient to manage it properly, because when you are dealing with cases of skin infections, two things I advise to the patient always. That one, first is the you should also take it as a tip, all of you, that you should tell the patient that if the lesion occurs more, or if there is any itching more, or there is increase of symptoms, don't worry and don't go to the allopathic doctor, or don't go anywhere else, because it may usually happen when you are giving medicines in the skin cases. So usually there is an aggravation which is being seen, a homeopathic aggravation in many of the cases I have seen in of skin, because and when you talk about especially psoriasis etc, I have seen the patient will come that ये तो बढ़ गया, ये तो बहुत ज्यादा हो गया आपकी दवाई के बाद, पहले तो फिर भी ठीक था, उससे ज्यादा हो गया. सो दैट मीन्स अब बहुत ज्यादा नहीं, दैट शुड नॉट बी वेरी मच aggravated, but the homeopathic aggravation may also be seen in skin cases. So you must tell the patient that guys, please take care. If you have, tell to your patient that please don't worry if there is little uh, more itching or increased itching or more burning, because that may occur due to my medicine. So when the patient suffers from that itching or burning na, so that patient will always build more trust on you, that doctor को तो पहले से ही पता था, doctor already knew that I will be suffering from more itching, matlab he's a good doctor. So that will increase more trust. Otherwise, what the patient, you will give the medicine, you won't counsel to the patient, you won't say any management part to the patient. He'll go back, he or she will develop more aggravation, then he won't come back to you anyhow. So the thing is, in skin cases, you must take care of this thing, because medicines show aggravation, a little homeopathic aggravation. The medicine is correct, it will show homeopathic aggravation slightly. So you must inform this to the patient. It will build more trust of the patient. And I also advise usually, as the general management also. So yes, if they have taken steroids for it, and we discontinue, yes, if we are giving medicines and then we discontinue steroids, there may be an aggravation, there may be rebound aggravation which may be seen. So patient must be told all these things before only, so that he build trust on you more. And the affected area, I usually tell them that they should keep neat and clean, hygiene must be maintained. No, they need not share their towels or clothes with others, because it may spread infection. Whether he's educated or he's uneducated, you must inform the patient as per the patient's language. You should ask them to not to scratch much. And usually in winters, they can also apply moisturizer or for soothing the skin, except for cases of psoriasis, as we discussed in the as we discussed in, I think 2-3 days before we had Dr. Shweta's session. The people were asking what to apply to soothe the patient. So we were discussing we can apply a moisturizer or coconut oil, but not in cases of psoriasis, or when there is bleeding, or when there is any discharge from the lesion, you should not apply. But if the dry lesion is there, you can apply moisturizer, obviously, or coconut oil. Or and you should not scratch, you should be told that they should not scratch the rash, because it may spread infection to other parts. Like this part is affected here, they'll itch, they'll scratch, and then they'll put the hand here also it will develop, or they'll put the hand here, anywhere they'll develop, they can develop this lesion. So they must be told that they should, if they're itching or scratching or just putting hand on their lesion, they must wash their hands and then only touch anything else, or their any other body part, because it may spread to other body parts as well. So the second visit, the patient came. She said that itching decreased, burning decreased, eruption reduced slightly, very slightly. It was very slight decrement and very slight improvement. It was only 10% improvement. I left the patient on placebo. I didn't prescribe any medicine. When the third visit, the patient came to me. This was the lesion, which was better, much better. And the itching already subsided. There was less of burning, and the eruption also came very much low. And then what happened was, see the lesion, it improved much. Then the fourth visit, when the patient came to me, it was somewhat aggravation, you can say, or the patient itching came back to the previous day, like it was happening before. There was a slight burning also, and the eruption also increased, like seen in the figure. So what I did was I prescribed, and because this thing was seen, and it was not to the due to the medicine. So I took a suggestion from a senior homeopath when I was discussing the case. So the senior homeopath told me to give a intercurrent remedy. In fact, an intercurrent nosode. I was doing some work of that senior homeopath on intercurrents during that time. So it just clicked to me that I can give an intercurrent at this point. So I prescribed intercurrent. That this was the, I think, the first case or the second, I think, when I prescribed an intercurrent remedy. Or and I gave her by Vaselinum 1 m single dose early morning, empty stomach. And the next visit, why not Sorinum rather than Basilinum, ma'am? Okay. So when you talk about tinea and ringworm, the best nosode we talk about is Basilinum. Just read Basilinum once, because it is exactly giving the symptoms like this. And I was not having those click symptoms like Sorinum. I already gave sulfur. So it is said that when the patient is not getting better by sulfur, you can also give Sorinum. Obviously, you can give Sorinum. But that winter aggravation or many of the symptoms of Sorinum, I was not finding on this in this case. So I think I prescribed that time Basilinum as the senior suggested to me. So, and I can say that Basilinum is such a wonderful remedy for skin cases. It acts so beautifully. And not only in this case, I've seen in many of the cases wherein there was affections of scalp, there were affections of many alopecia, and many other things were along coming. So Basilinum is a very good remedy to remove the miasmatic block. So yes, I prescribed at that time Basilinum 1. And the next visit after 20-25 days, patient came to me. There was no itching, there was no burning, no eruption. The patient presented like this. And then she was left on placebo for a month or two, and this all vanished. Afterwards, the patient didn't come to me back after this. And it was seriously a different case for me. Yes, sulfur would have cured the case. I may have repeated that time. The sulfur 1 m would have relieved, or maybe the thing was. But then the beauty of this case, which made me more confident or intercurrent remedy, the holistic approach is to be taken care of, because you have to remove the miasmatic block also of the patient, which the nosodes act very well. So intercurrent remedies are very much useful in many of the cases when the patient is not responding to you well. You're prescribing the very right remedy, and still the improvement is not occurring. The status quo position is there, and the patient is not improving. And the remedy is right, absolutely. The potency also is right as per you. Go for an intercurrent remedy, and I guarantee that after prescribing that intercurrent remedy, the similimum would act very well, and that will perfectly cure the case. So yes, thank you so much, Kavitha ma'am. It is a wonderful remedy for ringworms, and I think we have 5-10 minutes. We can discuss in short the rubrics and commonly used remedies if people are not getting bored. Thank you so much, Shweta ma'am. Sorry, I it was coming by Kavitha ma'am. So Dr. Shweta, thank you so much. Yes, basilinum is a very good remedy. And specific for, I think that is coming by my name, specific for seborrheic dermatitis. Absolutely true, Shweta ma'am. There are no specifics in homeopathy, no substitutes, no specific, no favorite remedies, nothing. But as per your experience, you develop things and you get to reprove those remedies which are already given on our materia medica on based on their symptoms. So whenever a patient come to you for seborrheic dermatitis, please prescribe on the basis of totality. Whatever totality you are getting, you want to take physical generals included, you want only the characteristic symptoms, the keynote symptoms, or you want to include the mental generals as well. So accordingly prescribe the remedy. Absolutely, that will result in cure. So thank you so much, Dr. Rao. These are just the complications tinea may lead to. It may also become inflammatory with appearance of vesicles, etc. Or it may also lead to alopecia, which is termed as cicatricial alopecia. The tinea capitis occurring over scalp may lead to cicatrices formation, which may result in baldness. Alopecia is baldness, and that may lead to permanent hair loss. So this is one of the complications which occurs in tinea. So there are few rubrics which I've taken from the repertory and which I've compiled from the repertory, the Homeopath Zomeo software, and then I've also compiled few of the remedies in short we can discuss. So there are many rubrics which are given for tinea in our repertory, like skin chapter, eruption, herpetic, circinate. So herpetic type of eruptions, which for which a wonderful remedy is arsenic album. Then there is one direct rubric which is given for tinea is in boric. Skin tinea favosa. It is clearly given, and see the remedies it's showing. Agaricus, a wonderful remedy. Arsenic iodatum, bromium, calcarea carb. Delcamara has given me so good results for itching. And raphitis, hippar, great remedies. Juglans regia, again a great remedy. Lapa, major. And Lycopodium, miserium, beautiful results for many of the extreme cases of tinea and other skin eruptions. Vinca, Viola, Oleander, Sulfur, Eustilago, great remedies for tinea. We have another rubric in boric given directly as tinea versicolor. So that clearly shows. Yes, tellurium. I also forgot one remedy with Basilinum sorinum. We also remember tellurium is an absolutely beautiful remedy for tinea, which give wonderful results. In cases of tinea versicolor, tinea corporis, in fact, chrysanthemum and natrum arsenicum, very good remedy. For trichophytosis ringworm also there are given remedies given. Rustox also included in that. Antim tart, antim crude also included. And then we have herpes again, for herpes tetry eruptions, these rubrics are given. So we can also discuss, we can also go for many of the other rubrics. And for the time being, we can also discuss this of many of the remedies, we were discussing already in this. We were already discussing. I'll just show you many of the rubrics in Zomeo. Okay. Okay. Wait a second. It's just opening. So. Yeah. So it's by the time it's opening, we can discuss few of the remedies like we were discussing: arsenic album, miserium, natrum miraticum, sepia, basilinum, sorinum, tellurium, many of the good remedies, belladonna. So when you see a patient with itching, burning, swelling, edema, extreme cases, I was reading anthracinum today, anthracinum, arsenic, pyrogenum, all three today when I was reading. So they are for the extreme cases of abscesses, pelons, etc. But they are very, but when you talk about arsenic, it is useful for the normal tinea lesions and other lesions also. And then for extreme cases like gangrene, ulceration, also arsenic is a wonderful remedy. So what is characteristic of arsenic is there are dry, rough, scaly eruptions which are worse by cold and scratching. Which are worse by cold and scratching. And I think we can discuss afterwards rubrics. And then we have belladonna, which is again dry, hot, swollen, sensitive eruptions which are like scarlet. We can remember, I was again reading Organon also yesterday. So I was reading Dr. Hahnemann's contributions. It was it clearly I remember he gave belladonna for scarlet fever, and his contribution of this belladonna in scarlatina was great, which is to be remembered. So yes, eruptions like scarlatina, we can use belladonna, wherein there is alternate redness and paleness of skin. We have mesarium, wherein there is eczema, intolerable itching is there, chilliness is there, pruritus is there, which person is worse in bed. The eruptions ulcerate. So they form thick scabs, like in tinea fascia. We also discussed there may be scab formation, and there is under purulent matter exudes. When there is pus filled, so then mesorium very good, very nicely. I guess Dr. Tong, in between there may be constipation also, which may be seen in arsenic. I think you are talking about. Yes. So natramur, again, natramur, a wonderful remedy wherein the skin is oily and the eruptions are dry. The greasy, oily skin, especially on the hairy parts, they have dry eruptions on the hairy scalp, bends of joints. The crust formation may be there, and usually in the bend of the limbs and the margins of the ears, when this behind the ears, when this is occurring. So natramur is a wonderful remedy. Especially for tinea capitis, I've seen great results by natramur. Sorinum again, we were discussing sorinum. So dirty, dingy look is there, dry, lustreless, rough hair is there, intolerable itching is there. You can see herpetic eruptions. It's good. Seborrheic dermatitis, somebody was asking. So sorinum has given me good results in seborrheic dermatitis. The indolent ulcers, crusty eruptions may be there. And then when you talk about Rustox, is a wonderful remedy for vesicular eruptions, a feeling of formication over the body, when the patient feels that there is some ant running over his or her body, and over the lesion, you can say, or there is red swelling, intense itching, vesicle formation, cellulitis, burning, eczematous eruptions may be there. There may be tendency to scale formation. So Rustox is a very wonderful remedy. And sepia again, there is that is more good for, very much good for herpes, circulatus eruptions, where and usually in isolated spots. There may be itching which is not relieved by scratching. They are worse in bends of elbows, knees. There ringworm link eruption. I also want to talk about two remedies. Dolichos is a very good, wonderful remedy for itching without eruptions when you talk about simple itching. And one more remedy I want to talk about, which have given me good results, is croton tick. A wonderful case which was treated when there was relief by gentle rubbing. That was a keynote marked symptom, a characteristic symptom I took in that case, and uh, I don't know what clicked me, but I prescribed croton tick 30 in that case, and that gave me great result in one case of tinea. I don't have those records, that record of that lesion, but yes, that was relieved by gentle rubbing. That was very much characteristic. I just clicked it, I just picked it up, and then it resulted. So do remember, when there is relieved by gentle rubbing, crouton tick is a great remedy for tinea. or any skin eruptions. Sulfur is a wonderful remedy, obviously. The aggravation usually seen in 11 a.m. in sulfur, zinc, both. And there is warmth in bed. The patient, when it becomes worse when he's warm, he's in bed at rest, and they are better by damp weather, dry warm weather, and usually lying on the right side. Oleander, again, a beautiful remedy. Yes, Dr. Shoaib. I just tell you oleander's symptoms. Yes, wonderful remedy. Oleander gives results. And for today, I would like you to take away this message that yes, tinea is very, homeopathy has a great scope in cases of tinea, in fact, all skin infections, and we have got better results than any other pathies because of our considering the individualized approach, the holistic approach, taking the person as a whole, totality, covering the totality of symptoms, and then trying to break those obstacles to cure, whether it's the fundamental cause, whether it's the exciting cause which is leading to the disease. So don't lose confidence when you are dealing with any case. Especially of skin case, when you talk about this presentation, where say we should not we feel confident, feel underconfident, because homeopathy can show miracles. And as it's proved by many of, already we discussed so many cases of doctors yesterday also, and we are running these webinars since long. So we are able to see so many good results with great remedies. So yes, it is a wonder, and one must remember that you will get optimistic results, incredibly optimistic results, when you're dealing with tinea infections, because homeopathy improves the texture of the skin, as well as it decreases the patches, and then it brings back the normal skin, and it reverts you to the normal condition, like the already skin was there, without leaving any pigmentation or any mark or any scar or anything. It is leaving. So it is a very good remedy which you should remember. For oleander, I've already opened. Though skin of oleander is very sensitive and easily chaffed and chapped, it is saying. And usually when this skin infections are occurring with conditions like gastroenteritis. So this is a thank you so much for oleander, Dr. Shoaib. It is a very uncommon and concomitant, and it is a very good remedy for those skin infections, sensitive skin infections, which are occurring along with gastroenteritis or GERD complaints. So you can go for it. I also read it right now only. So yes, you can use your oleander with the GI infections. And last not the least, I once again want to thank everybody for your patient listening. I hope I could give a good point or something knowledgeable through my session of today. At least if you got to learn one or two things and you can use that in practice, that would be that then my motive of today's presentation is done. So for any queries, you can also mail me at dryashika@gmail.com, or you can WhatsApp me. And thank you so much, Kavitha Holistic Approach. Kavitha, and you can also follow us on kavithahomeo.com and all our social portals. We are trying to do something different for the homeopathy. And thank you everybody for giving me this opportunity to present. I hope I did my part well. Thank you.
Dr. Sweta, would you like to take any questions in the chat?
Dr. Yashika, can we start with the questions?
Yes, ma'am, we can.
Okay.
I think there is a question.
Yes, we have a question from Dr. Ashok Madan. Doctor, what rubric is being used for fungal infection of finger and toenails?
So it is already given when you see really Ken's or any skin chapter. There are eruptions which are given. So in that eruptions, there is a that's given on the side and everything. So there is already present. I am just showing the home software only. I didn't put the key actually. That's why I couldn't show. So I am just opening the thing. But it is obviously for the nails. It's given eruptions nails, and the type is also given. Whatever lesions are occurring. I'll just show once. Any other question, ma'am, for the time being once the software opens? I think Regina ma'am have a
Yes,
question.
Professor Regina ma'am wants to ask you a question. Ma'am, please.
Yes, Dr. Yashika, wonderful presentation. It was a very, very contentious webinar. I learned a lot from you. Thank you so much. The question is on tinea corporis. If the first medication you go through is sulfur,
Sorry, I didn't get your question, ma'am.
for the tinea corporis, the ringworm, the first medication you go through is sulfur.
Yes, ma'am. No, for this case, I chose sulfur. Hello?
Yes, I'm listening.
For this case, I've chosen sulfur because it was covering the whole totality, mentals as well as the physicals, and the hot. She was a hot patient, and the lesions were showing aggravation at night. So that's why it was chosen for the first time, like for in this case. But yes, if the symptoms would have somewhat different, the skin would have been oily, or there have been other symptoms, associated symptoms. So we may also switch. We may also have switched to other remedies like CPR and Atamure, any other remedies, so Rhinum, etc. So yes, for this case, I chose sulfur.
Thank you
Dr.
very much.
Dr. Yashika, we can't see you. Please
Yes,
start
ma'am.
your video.
One minute. I'm just owning. I was just opening the
Okay,
software.
okay.
Wait.
Till then,
Yeah. By the time we can discuss more questions.
yes. Next question from Dr. Bhuvan Kumar is in sulfur 200 and sulfur 0/2 LM potency, which one is best for tinea? Your suggestions.
In
between sulfur 200 or sulfur 0/2 LM potency, which one is best for tinea treatment?
Okay, so I think it all depends on the case. Usually, the availability of LM potency also restricts us sometime. But if you want to ignore the aggravation in the patient, one must go for 0/1. We can start with 0/1 and 0/2 first, and that would give good results, obviously, because the least homeopathic aggravation would be seen. And when you talk about sulfur 200, obviously sulfur 200 shows somewhat aggravation. It depends on the obviously on the potency that we are doing. So LM potency obviously has less aggravating symptoms, and the patient would be much happy because results would occur before. So that's why I think 0/2 is great, acts good.
Yes, definitely. LM potency is basically avoids homeopathic aggravations, and yes, it depends on the susceptibility of the patient also, and what totality you have formed. If you have taken strong mental symptoms, you can go for higher potencies, and if you have lot of physical generals and other symptoms, you can start with low potencies. Thank you, Dr. Yashika. And next question. Is there any specific remedy for seborrheic dermatitis?
Ma'am, I already replied this question,
Yes,
that
there are
you
no
also replied that there are no specifics. Aphorism number 149 says it all, that you cannot prescribe specific remedy. I think 149 or 147, I'm not sure, 149 only. That you should not use specific remedies. It all depends on the totality of the symptoms. It depends on you that you want to include the mental genres or the physical genres along with the characteristic. But yes, as per the totality only, one must prescribe.
Okay. I think we are done with the questions. If
The actually there is some issue with this. Is like that's why I'm opening in the laptop only, in the phone only. I'll just type in the chat box. By the time we can have a discussion, uh, if we want to have, I'll just type the rubric in the.
Yes, don't worry, Dr. Yashika. You can later send it to them, whoever is requested. So the information.
there is one more question from Dr. Vismay Prajapati. How often the appearance of eruptions have been beneficial in prescribing? As it is mentioned multiple times by stalwarts that in all local maladies, it is of value.
Yeah, because I think it's already given in these aphorisms of local diseases from 210 to 230. Sorry, not 210 to, it is given from 185 to 210 aphorisms, that you should these eruptions are of very much multiple value, because once these eruptions are suppressed, the body will be affected internally. The vital organs, it may obviously, it says that when we suppress the eruptions, the patient goes into the latent sora stage. When you relate it with the organon philosophy, so it will go into the latent sora stage, and it will come up with the new malady. So one must, the patient, if he's coming for the very first, when he's facing eruptions, and he's having the local malady or the eruption present, that is a very good thing for us, because we can treat the patient without, we can cure that patient much better, because the local eruption is present. If the local eruption is suppressed, then it is always difficult to remove that miasmatic block, because the patient goes into the latent sora stage. So it is very much beneficial in prescribing. You want to say something, Regina, ma'am?
Yes, I deal with homeless people, and the ringworm is very often seen. Sometimes you heal, and then 2 months later they come back again. So I have used apple vinegar on top of the lesion, and soak up cotton and then place it there. And the client says it itches, but then it soothes the affected area. So I would like
Yes,
just to
ma'am.
share this experience. Apple vinegar. Thank you.
Thank you so much, ma'am. Yes, thank you. So I've already posted in the chat box about the nails rubrics. The FATAC repertory says, gives very good rubrics for nails, and clear rubrics. That is again an alphabetic repertory, so you don't need to search. You just go to the and then nails are given. So nails, brittle nails, crumbling, every symptom is given for the nails, and eczema occurring, eruptions occurring. Uh, with nails, around the nails, and एक second. Fingers, eczema, loss of nails with fingers, nails affected. So these are many of the rubrics which are given. I think nails scaling, nails splitting, nails ulcer, nails under growth. So there are many rubrics which are given in the and in fact in the pain also, pain, neuralgia, in general, nail clavers, when there is this onychomycosis. So if the patient is suffering from any sort of burning or pain, so these are the rubrics given. I hope Dr. Ashok's point is clear. I will also post from the Ken's ones. By the time if we still have questions, ma'am, we can discuss more questions.
I request all the viewers to please write their question in the chat box. And till then, we would like to request Dr. Kavitha ma'am to share her views on today's webinar. Over to you, ma'am.
Sure. Thank you so much, Dr. Yashika. It was a wonderful webinar. And like the sharing of your knowledge on several conditions of tinea is very well presented. And we really enjoyed with the case how you went through and come up with the remedy, and the cure is really the nice way of presentation. And moreover, it is an interactive webinar refreshing our minds. See, mostly the skin complaints, they come up with suppression by steroids and ointments. That is a common thing. And when using the homeopathy and you following the Hering's law of cure, the cure has come up. So that is really great. And many congratulations for this great session. And Dr. Sweta, would you like to add anything more, please?
Yes, ma'am. Thank you for your comments, and very well explained, Dr. Yashika. Lovely presentation, and thank you so much for sharing your up-to-date knowledge today. And if we have any questions, no questions yet. So, would you like to say anything, Professor Regina, ma'am?
I'm done. Thank you.
Thank you.
But anytime, if you have any more questions, Yashika is available on Homeopathy 360 on her personal email. She's so prompt and she can answer many questions, and on our car study group also. So we will convey anything if you have. So anything more, Dr. Yashika, you would say for this session, or how do you want to wind up?
Just a thank you to all because I'm always glad to get motivation from all my seniors as well as such a great support. I think I'm so blessed because because of the support which I'm receiving from everybody. I cannot express my feelings on this because it feels actually good and blessed that I have so good people in my life who are there to guide me, who are there to teach me, who are there to tell me when I'm wrong or right, and also to motivate me, bring me to a different level, and they are trying their level best to like to improve upon me as well as giving me so many opportunities. So I'm glad always that I get so good people in my life. So I'm just I cannot express my thank you. Obviously, there are so many people who have been who have contributed a lot with what I am doing today. What I'm able to do today, what I am up to. So there are so many people I cannot even name them because that's a long list. So thank you all. I would just say thank you, ma'am. Thank you, Ka Homeopathy Study Group, and thank you, Manish sir. Homeopathy 360.
We are fortunate to have you.
Oh,
And
that's so sweet of you.
in one word, everyone is so happy, and Professor Regina and Dr. Sweta and whole holistic approach team. So, shall I announce tomorrow's webinar?
Yes, please.
Yes, ma'am.
So tomorrow we have wonderful session with Dr. Hira Agarwal on topic management of cancer with homeopathy. It's a wide topic, and you all know Dr. Hira Agarwal, so do not miss that great opportunity, and do not miss to see Dr. Yashika again. So see you all, and thank you so much, Dr. Yashika, Manish Jain, and Homeopathy 360 team, and Kav Homeopathy Study Group team for this making this great sessions and webinars. Thank you all.
Thank you, ma'am. Thank you, everyone. So we can end this session of the day with all your permission. And I'm thankful to all the audience for joining us today. Thank you. Thank you, ma'am. Thank you.
See you all tomorrow. Thank you.
Good night. Bye-bye. Namaskaram.
Namaskaram.
Yes, ma'am. I remember. Okay, bye.
Bye.
Yes.